5 habits that are destroying your erections. Let me ask you a question. Curious, have you ever noticed that your erections are not as strong as they used to be? Maybe they are weaker. Maybe they take longer to appear, or maybe they disappear faster than before. Now, here is the interesting part. Pause. Many men think erectile problems are caused only by age, or by testosterone, or by some kind of medical condition. But what if the real problem was something else? What if your daily habits were silently destroying your erections? Because the truth is that most cases of erectile dysfunction are not caused by permanent physical damage, they are caused by lifestyle, by things men do every day without realizing how much they affect their sexual health. And today, we are going to talk about 5 habits that can seriously damage erectile function, habits that reduce blood flow, habits that destroy hormonal balance, habits that affect your nervous system and your brain. And the surprising part is that millions of men repeat these habits every single day. So, if you want to protect your erections, improve sexual performance, and maintain healthy erectile function for years, this video may be extremely important for you. Because once you understand these habits, you can start changing them immediately. But before we go deeper into the topic, let me briefly introduce myself. My name is Dr. César Noval. I am a plastic surgeon and specialist in male sexual surgery, including penile enlargement procedures and gender surgery. I am also the director of Clínica NEF, where we treat patients in Spain, Mexico, and Miami. Our main YouTube channel, Clínica NEF, in Spanish, has more than 100,000 subscribers, where we publish educational content about male sexual health, penis anatomy, erections, and surgical treatments. This English channel was created using artificial intelligence technology so that we can bring this information to a global audience. Because unfortunately, male sexual health is still surrounded by myths, misinformation, and unrealistic expectations. And our goal is to provide clear medical information based on science and clinical experience. Now that we have introduced the topic, let's talk about the first habit that can damage erections. And this one may surprise many people: alcohol. Many men associate alcohol with sex. They think alcohol helps them relax, improves confidence, and makes sexual encounters easier. And in small amounts, alcohol can reduce anxiety and help people feel more relaxed. But when alcohol consumption becomes frequent or excessive, the effect on erections can be very negative. Alcohol is a central nervous system depressant. This means it slows down the communication between the brain and the body. But erections require extremely precise neurological communication. The brain must send signals through the spinal cord to the penile nerves. Those nerves must release nitric oxide, blood vessels must relax, and blood must flow into the erectile chambers. Alcohol interferes with this entire process. It reduces nerve sensitivity, it decreases blood flow, and it can make erections weaker and more difficult to maintain. Chronic alcohol consumption can also reduce testosterone levels and damage blood vessels, which means the problem becomes even worse over time. The second habit that can damage erections is something that many people never expect: pornography, overconsumption. Pornography itself is not necessarily the problem. The issue appears when exposure becomes excessive. The human brain is extremely sensitive to dopamine. Dopamine is the neurotransmitter related to pleasure and reward. When men watch pornography, dopamine levels increase significantly. But when exposure becomes constant and intense, the brain begins to adapt. The reward system becomes less sensitive, and real sexual stimulation may no longer produce the same level of excitement. This phenomenon is sometimes called porn induced erectile dysfunction. Men may notice that erections are strong during pornography consumption, but weaker during real sexual encounters. The brain becomes conditioned to specific types of visual stimulation that are difficult to replicate in real life. Over time, this can affect sexual confidence, arousal patterns, and erectile response. The third habit that can destroy erections is stress. This is probably one of the most underestimated causes of erectile dysfunction. Stress activates the sympathetic nervous system. This is the system responsible for the fight or flight response. When the body is under stress, adrenaline levels increase, heart rate increases, blood vessels constrict, and the body prepares for survival. But erections require the opposite state. Erections occur when the parasympathetic nervous system is active. This system promotes relaxation and blood vessel dilation. So when a man is under chronic stress, the body remains in a state that is physiologically incompatible with erections. Work pressure, financial worries, relationship problems, sleep deprivation, all of these factors increase cortisol levels, and high cortisol levels suppress testosterone production and reduce sexual desire. The fourth habit that damages erections is poor sleep. Sleep is not just about rest. During sleep, the body performs important hormonal and neurological processes. Testosterone production occurs primarily during deep sleep. Men who sleep less than 6 hours per night often experience lower testosterone levels. Sleep is also when nocturnal erections occur. These spontaneous erections during REM sleep help maintain penile tissue health. They increase oxygenation of the erectile tissues, they maintain elasticity, and they support vascular function. When sleep is chronically reduced, these processes are interrupted, and over time, erectile quality may decline. Finally, the fifth habit that can destroy erections is obesity. Excess body fat affects sexual health in several ways. First, obesity reduces testosterone levels. Fat tissue converts testosterone into estrogen through an enzyme called aromatase. This means that higher fat levels often lead to lower testosterone. Second, obesity is strongly associated with cardiovascular disease, and erections depend heavily on healthy blood circulation. If blood vessels are damaged by high cholesterol, hypertension, or metabolic syndrome, blood flow to the penis may decrease. Third, abdominal fat can accumulate in the suprapubic area. This fat pad can partially hide the base of the penis, making it appear smaller and sometimes affecting sexual function. In many cases, weight loss alone can significantly improve erectile quality. So when we analyze these five habits together, a very interesting pattern appears. Most erectile problems are not caused by irreversible damage. They are caused by lifestyle factors that can be modified: alcohol consumption, pornography overexposure, chronic stress, poor sleep, excess body fat. When these factors are improved, erectile function often improves as well. This is why lifestyle optimization is always the first step in sexual health treatment. Before medications, before supplements, before surgical procedures, because the body has an incredible capacity to recover when the underlying causes are addressed. And this is one of the most important messages we try to share through this channel. Sexual health is not just about the penis, it is about the entire body: cardiovascular health, hormonal balance, neurological function, psychological well being. All of these systems work together to produce healthy erections. So, if you want to protect your sexual health long term, focus first on the fundamentals: improve sleep, reduce stress, maintain a healthy weight, exercise regularly, and limit habits that damage your vascular system. Because when the body becomes healthier, erections usually follow. If you found this information useful and you want to learn more about male sexual health, erections, penis anatomy, and medical treatments, make sure to subscribe to the channel. Our goal is to provide clear, scientific information about male sexual health so that more men can understand their bodies and improve their well-being. Because understanding your body is always the first step toward improving it.